Are we doing the countdown, James? Oh, there we go. I'm just going to ask a question. Oh, so is the countdown going to go off? Okay, I'm going to assume we're live. I want to thank you guys for joining us here for Unscripted. Good morning. Again, before we start, I'd like to definitely say thank you for all that you do. We talk about, I'm wearing my superhero shirt because I believe you guys are heroes. You guys are they say that heroes are the first to charge. Good morning, good morning, good morning. Happy Saturday. We have a very special show today. We're going to be talking to some professionals, some real superheroes out there, in this fight against COVID. And we're going to go, talk about, hear some stories. We're going to dispel some rumors, hopefully, and, go over see if we can answer some questions that you have out there. Dana, good morning.
Good morning, sir. So today I'm really excited. We have some of my good friends on, and I know there's been a lot of fear, and I just wanted to hopefully help and bring out these beautiful beings to shine some light on this. We've seen so many videos on like YouTube being spread around Facebook, and and a lot of fear is just like going all over the place. I just want to, exactly what you said, debunk and all that good stuff. So we have, I don't know how much longer when they come on, but what do we?
Okay, so let's go ahead and bring them on. Go ahead and introduce the guests as they appear.
Okay. So we're having a little technical difficulty due to all the fires and stuff going on. Our main guy, so Mr. James Hicks, he's dealing with some stuff up there. So thank you, James. Here we have one of my bestest friends, Lynn, RN, Director of Case Management, ER nurse, Ms. Zoe, and our beautiful Dr. Laura Goddard, psychologist and clinical director, Pepperdine alumni, all that good stuff, helping a lot of people. These ladies have been dealing with a lot of stuff, I'm sure. Higher cases, I guess we could probably start with Zoe. You're the front line, seeing everything. I had called Lynn, like, panicking about this video that we saw. I'm like, Lynn, oh my gosh, this video, this lady's like, all these people being put into the hospital and being diagnosed with COVID, and they're not. So people are like, I don't need to wear a mask, it's not real. So all these kind of stuff. So I just wondered, like, your thoughts on it being really real or really not real, and your thoughts on that?
Well, being on the front line, it's very real to me and to the hospital staff. We've seen a lot of increase in the COVID cases recently, especially with younger people. And the good news is younger people are able to have recovery without any residual, or some of them doesn't even have any symptoms, but they had come into contact with people that have COVID. But the real problem is the people that will get sick from being in contact with them, like people with diabetes and people that have poor immunity or cancer patients.
Yeah.
That's great. I was during the introduction. I was actually talking about I was wearing this superhero, this Superman shirt because I believe you guys are the heroes. You know, you're heroes. They say heroes tend to run towards the danger, and being in the front lines, Zoe, you are right there in the thick of it. What helps you to prepare mentally? You know, as you go into work every day and this lockdown and being able to see people and possibly running into people that don't like to wear a mask. How do you guys deal with that?
Being in the front line for me, I prepare myself mentally even before COVID happened. I meditate every day and I do positive self-talk on my way to work. You're going to have a great shift tonight. Like I always tell my patient, I treat them like an unborn child. I already like my patient or I already love my patient before I even meet them. That way, if they turn out to not be having a good day or they're not in the greatest mood, then I already have extra patience and understanding for them. And that's called compassion. Especially now, people are on the edge. They might not have the support system that they need. They might be alone in the quarantine and just going crazy financially, emotionally. Everything is falling apart. And in that moment, you're the only person that they could go to, and you have to be strong and be able to deal with them at the same time, giving them boundaries.
Yeah.
We also have Dr. Laura Goddard. So it says here you are a psychologist.
I'm actually
Dana,
a PhD.
PhD. So Dana talked earlier about this video that we saw earlier about. I mean, we see all kinds of videos, right? We have people that don't want to wear a mask, and you know they're saying, "Oh, I have a right not to wear a mask." And in this particular situation, this person said, "Hey, I have a right not to wear a mask," but she still thought she wanted to be seen. But the staff says, "Hey, we also have a right not to service you." So what do you think goes through someone's mind when they're thinking that?
Um, in my office, a lot of clients, they come with no mask. So they have two options: to wear the mask or they can leave. But I address that with them before I give them the option. The main reason they don't want to wear the mask, they don't want to face the reality. It's there. You have to protect yourself. You have to protect your family. You have to protect others. It's not about you. So sometimes take me 10, 15 minutes to process this. And I offer them mask in my office. They wear it during the session. What comes behind it, why they don't want to wear it, is really anxiety and depression. The minute they put the mask for them is they are anxious, they are depressed. Does the mask represent to them? It's not as much as they are defiant and they don't want to comply. So we have to go deeper to the issue why they don't want to wear the mask. They are in my office, they need help. So they start with, I don't want to wear the mask. What you can do about it? It's not about me or you. It's about what we need to do. So that's really important that we process it with them in a very calm manner. It's not like you are forced to wear the mask. You will want to wear the mask to protect yourself, your family, and others. And only then they accept the mask from me and they wear it. So before we go into the action, we have to go into deeper what's really bring the action.
All right. I think that's important.
And a lot of depression, anxiety. Last week, 47 clients I had to see because of the holidays. 23%, they were almost suicidal. So the reality is really hitting a lot of people about COVID. It's a very silent way. We don't see it. So it's really, thank you for offering this show. Maybe people, they can ask questions and see how we can help them.
Absolutely. I think one of the main reasons people do have that depression stuff, thank you, doctor, is because they don't believe it. And like you said, they're in disbelief or in denial. I believe it has a lot to do with the social media and how fast news is spreading and penetrating into people's minds. Like I said earlier, I had to call my good friend here, Lynn, and I was like, can you tell me if this is true? Like, what is this? And can you tell us what you told?
Yeah,
You told me?
absolutely. I mean, Dana reached out to me and said, "Is this real? I mean, what are you seeing in your spectrum, in your end of the world, in the hospital?" My role in the hospital, I'm a case manager, a director. I have a team of RNs and social workers that deal with patients, especially during discharge and families. And so we deal with a lot of family dynamics, social issues that happen even after the patient's discharged. I mean, even families that are in panic and when they send their loved ones in the hospital and they can't visit them because we don't have any visitors. So allowed at the time. So, there's definitely a lot of fear, a lot of panic. And we deal with that as we deal with patients' ongoing issues in the hospital. So just to kind of start from the beginning, obviously in the beginning of COVID, there was still a lot of questions about, how it's, how it spread, how to prevent it. And a lot of people they were uneducated about how to take care of a COVID patient or what happens if you have COVID or, so we had multiple questions about that in the beginning. Of course, in the beginning, I would say first month or two of when COVID broke out, we did have a surge of patients. Like Zoe said, the patients were initially like elderly patients, I would say from like 50s to 60s that have some type of comorbidity, diabetes, and some chronic like diabetes and I think CHF, any cardiac underlying issues. They were like most at risk. And patients that were compromised, like patients that are immunocompromised, such as cancer patients. They were also patients that were at higher risk for getting COVID. So in the beginning, we did have a lot of those. And then there was it wasn't really a second surge, but I would say it was a second time around when I think it was maybe after 4th of July when people started to loosen up. And then there was another increase of COVIDs, and they were more younger. So we would say like in their 30s and 40s. And we've seen a variation of patients that are young that do come out of it like mild symptoms. They get treated and they get discharged within a day or two. And then we have even young ones that stay longer because they are not doing better. And we still have a few that, end up having ventilators because they couldn't recover even with multiple treatments that are being done in the hospital. So we've dealt with a wide spectrum of patients. So are you asking me, is this real? Yes, this is real. Like I can't make this up, guys. I mean, I've seen families where the whole family had it, and I was telling Dana the other day, I don't understand, like a mom, a dad, and two sisters, they all had it. The mom and the sister had mild symptoms, but the dad and the youngest sister, who was in her 30s, had it really bad. And up to the point where they actually didn't make it. So it's real life, that we deal with, and it's hard because we deal with the aftermath, not just at the time, but we have to talk to the other sister and the mom about, now they're grieving. Now, what do they do? How do they protect themselves moving forward? I mean, these are just kind of some situations. I'm sure Zoe, being in the front line, she sees more of it firsthand, but we do deal with it towards the end when we're ready to discharge these patients and they have to go back to the community, So.
Thank you. Does it look like, I know they're saying that a lot of places are opening up and they're saying that their numbers are going down. Are we seeing, oh, by the way, are any of the viewers out there, if you have any questions, please feel free to ask our panelists, and see if we can get some questions answered for you. But do we see the numbers coming down, Zoe? Like when you come in, I mean, is the number kind of plateaued? Is it kind of shrinking? Is it still growing? What do you think?
The numbers are still growing because now we're having the ability to test more. Now we have rapid testing where we could test in 15 minutes for patients that are having an emergency surgery, but are not necessarily there for COVID symptoms. So let's say someone was having abdominal pain and ended up to be having appendicitis and need emergency surgery, then we're able to expedite 15-minute rapid COVID test. Most of the time, they are negative, especially if they have no symptoms. And we also have 3-hour rapid testing for patients that are admitted to the hospital. We have to test them to be able to segregate them from the regular population. So we separate our COVID from our non-COVID. Even in the emergency room, we have a screening tent outside. And if you have any symptoms such as fever or cough, you go to the red side. And for like headache with no symptoms, you go to the green side. So I want the general public to know that it's safe to go to the hospital because we do screen everybody with temperature check, the visitors, questionnaire, and every triage is separated. We do have a 2 triage room. We do have COVID area in the emergency room with negative pressure room that we have built extra ER quick care area into an underground part of our hospital. So everything is segregated. So as far as what was your question again? I kind of lost track a little bit.
No, I think
If
you
we're
answered it.
seeing more
More, yeah.
patients.
The numbers
Yeah,
are still
now
kind of
that we
growing.
have now that we have more ability to test, we are seeing more positives as well as negatives. So it's a mixture. I'm just glad that we do have the ability to test more than in the beginning of the COVID.
There's a question out to the panelists. Looks like Anthony is asking, if a vaccine is released before the election, do you plan on getting vaccinated? Do you recommend the vaccination or anyone to be vaccinated? Might be a loaded question.
As a frontline healthcare worker, I don't think I have a choice.
Yes.
We do need to get, and Rossa knows, you are required. We are required to get vaccinated, regardless of it's a trial or a new vaccine or a new outbreak, because we're on the front line. So the only other option is for us to not work. So yes, we do unfortunately have to be vaccinated.
Yes, and that even our flu vaccine is a requirement in our hospital. So we have to have a flu vaccine every year as a requirement. So I think that would be a requirement because we are frontline and we do, we speak with patients and families and we have a duty to protect others.
Would you want your kids to take it?
You don't have to answer. It might be loaded. I know you guys got to go back to offices.
I'm just because Anthony just asked, would you be comfortable?
Well, I'm sure there's a lot of testing that's going to be involved, and definitely there's going to be a lot of information coming to make a good decision, and so right now that's still unknown. But for us healthcare workers, that's something that's going to be coming up to the surface for the hospital if they require us to get that.
So Dr. Goddard, is it a requirement that someone be tested for COVID prior to being seen, or is there a special circumstance for every situation for getting tested?
No, but we have procedure here in the office. We have to have social distance. We have to have masks. We have to check the temperature. And before we get to that, maybe at the end of the show, I'd like to kind of touch up on the impact of COVID on the high school kids when I have the chance, not now. Yes, we have procedure here if they come to the office. Temperature, social distance, wearing mask. We have sanitizers. We have to protect them and protect ourselves at the same time. I wear mask and they wear mask. But do they have to get tested? No. But if they are tested positive, definitely they have to let me know. And I will not see them until they get tested negative again. We can do it through Zoom. I do a lot of Zoom meeting with a lot of my clients, but some of the clients, due to the severity of their diagnosis, I have to see them face to face. I have to make sure they're not suicidal. I have to make sure they're not losing their job. So sometimes I have to see face to face client, but I have conditions for that.
Right. I think that's I think that would be a difficult situation. And this is where I say that heroes are running to the danger, because I think mentally you have to prepare yourself. Someone says, hey, I have COVID. You're like, hey, I have a family, I'm a doctor, but I want to treat this person. What's the mental, what do you, I mean, I know you're in there to provide that service. What goes to your mind if someone has, if it even has happened, has someone come to you and said, hey, I have COVID, I still need to be seen?
It didn't happen. I have one client had COVID, but I haven't seen her in 3 months. She just got tested now negative, and she wants to come and see me. I would like to wait another 2-3 weeks before I see her. But I do Zoom meeting a lot with my client. I do telehealth. The only client I need to see them 100% in my office, where I want to make sure
How about
provide them with the service I need to provide them.
Thank you. I think that's tough. What about Zoe and Lynn? What do you? I apologize. I call Lynn. Her name is Rosalind there, but she goes by Lynn.
That's okay.
Family friend.
That's my nickname.
So, what do you?
So what I know from the electives is like they have to be tested COVID first. So elective surgeries like total knee replacements, total joint replacements. So those type of elective surgeries, they do have to test negative before they're they could have their surgery. At least that population I'm aware of.
I know a lot of people like are afraid to go to the doctor because of like, I had like a little rash and I was like, I am not going to go. I started doing like these homeopathic stuff and it was just getting worse. I was like, I got to go to the doctor. But I was really afraid. Zoe touched on how safe it is to go. And I'm really thankful to know those things. The video that I was telling you about from the New York doctor, I wanted to touch base on that one more time because I want people to know what you told me about how many people are actually involved in one treatment and not just let you pass away, you know. Do you remember that? I forgot that video.
I think you said like how, because in the video it showed like they were not coronavirus, but they were reporting that the patient had coronavirus. Well, in our system, there's just no way because, it from the ER nurse to the ER physicians, all the way to the inpatient nurse, inpatient physicians, the therapist, everyone that touches that patient has to see that record. And there's no way you can hide that it's a COVID versus a non-COVID. It's very distinct for us. The results are there. They're very clear. The patient is on specific isolation precautions for COVID. We have a COVID wing. I mean, these things I don't think you can make up a patient who has not a COVID to be a COVID because we do have specific process for COVID patients. And that's why I just couldn't believe how that can go through a whole system, everybody who touches that patient and say that was a hoax, like that really was not a COVID patient. And that I can't comprehend that, at least where we work, right. So I can't speak for other hospitals, but I know for sure, I mean, Zoe and I work in the same place and there's no way we could not distinguish a COVID versus non.
I think Dana is talking about a video that where a nurse, just to give some context to the viewers, a nurse started working at this new hospital, I believe in New York. She went with a hidden camera. And then what happened was they were trying, I know the producer was asking for the video. So she goes in with a camera, and then what she was kind of appalled about is that they were saying, there's a whole wing of people with COVID that were getting tested. Some people that didn't get tested were still in that wing. And then when she goes in there, there was like I don't know all the codes, but she was talking about a no. They gave her a no resuscitation code if this person tests, and she said that she was going to go. And some other nurses said, "Hey, my job is to help them. If that person's going into this into this code, we're going to go in there and apply CPR." And one of the resident doctors was saying, "No, don't do that." So I think that's the one that was on. That is that the one you're referring to, Dana?
Yes,
There was
I
a
think
nurse
it was
from New York, right? The New York nurse that was undercover and saying that patients are being diagnosed for COVID to get some sort of reimbursement. The hospital gets some type of monetary reimbursement for patients that are COVID. So they're inflating COVID patients. So basically saying that COVID patients are dying, but they were in fact not COVID. Right. I think that was the gist of that video.
I think there was parts of it. Exactly. Yeah. So there was like a whole, they did like sections like, bad codes or, it was, I think what happens is not just in social media, but we have to, what media in my mind should do is be kind of unbiased. You know what I'm saying? So like a media, you should have two sides to get your information. You want to make sure you have information from this side and this side, not just one-sided, where you can sometimes go to a media and say, somebody else says, oh yeah, Fox News is pro-Trump, or or CNN is pro, someone else. It should just be media centers giving you information and allowing you to decide what to make of that information. But anyway, thank you for answering that. Again, it is a situation because social media drives a lot, especially while everyone's locked at home. It drives a lot of people crazy, because it's either it's serious or it's not serious. The numbers are real, the numbers are not real. In my mind, what do you guys, even though that is in our minds, it's real or not real, what do you suggest we do?
I think, if you don't mind if I speak first, I think the media in general has the ability to influence people in general. So whether you're in a little podcast or you're on Facebook going live with 1, 2, or 2,000 or 2 million followers, I think you need to be um, open and honest with your opinion and not be one-sided. I think this nurse does not have as much experience in the emergency room. She was a travel nurse, and she was there for profit because nurses there that are traveling at that time. This happened during the beginning of the quarantine, where a lot of things are unknown, a lot of variables are unknown, and people, especially the healthcare workers, are being protective of themselves as far as do not resuscitate this one or that one. There's a lot of air exchange and a lot of um, danger that could be presented to the healthcare worker when you're intubating a patient. There's blood and involved everywhere. So you're exposing a lot of people for someone that the diagnosis already is. So it's not her call to make as for the judgment of the doctor. And like I said, this happened during the beginning of the quarantine. From a point of view of a nurse who's already biased, who's there to expose something bad, not to expose the truth, not to expose the daily events. So I think it's everybody's responsibility to show what is happening without putting their own opinion into um, and influencing other people. If you want to influence someone, influence goodness, influence how to survive during the COVID. Because real or not, we're all in this together. And it is happening beyond more measures than we could ever imagine. Um, longer than we have imagined it to be or hope it to be. Right now, we're expecting for summer. We're expecting to have a good year. We're expecting to have Christmas and Halloween coming in. But this thing is here to stay. So we could either keep bringing fake news and instilling fear into people, or just telling them how to go through each day until we get through the year.
Exactly.
And she said it right. This is here to stay. So we have to be informed And this is, whatever platform we use. For us, we do it on a daily because we use that as our tool as nurses to educating patients and families is what we do every day. So and our family and friends, of course, because we get questions like this all the time. And now flu season hasn't even hit yet, so that's something coming for us as well, on top of COVID. So we really have to be prepared.
Thank you. I like that. So she said fake news. I like touching on fake news. Yeah. So we have another question in a panel. I'm thinking he's talking about soldiers. PPE has the PPE situation improved for healthcare soldiers since the first wave? And I think what he means is, is there a readily a supply of PPE now for the staff and for patients today?
I think we do. I feel like comparing to when it first began, where we have to recycle our mask or wear the same mask for days and weeks at a time. I don't know if people are aware that nurses in the emergency room and COVID unit have to wear an N95 and a mask over it, and you have to wear that for the entirety of your shift. Before COVID happens, you wear that every patient, you change it out. But now you're wearing it every shift, and then for the whole week or sometimes for the month. But recently, I've been able to change my mask every shift, or if it drops to the floor, there's a mask readily available for me to have. And each of our patients do have a mask. If I do see a patient taking off their mask, I just go in there and I put on another mask for them. I don't give them the option of not wearing a mask. So, here you go. Here's a mask. You take it out. I'm just going to keep putting one on you. I mean, it's not really a power struggle anymore. You're in a place where mask is required, period.
That's pretty awesome. Thank you for that. Yeah, I think it's important. I think what we do in our daily lives is, as on the other side of your spectrum, we're like the patients coming in to your. I think, in my mind, when in doubt, just put it on. It takes a couple minutes. I don't wear a mask driving in the car and walking around if I'm not around anybody, but I will wear a mask when I'm close to somebody. If I'm within if I'm going to be exposed to other people, I think it's important that I do my responsibility to be considerate of others. If anybody can think, I mean, that's the best way to think. Be considerate of others. It's not about you. It's about, what if something jumped on you and it jumped on someone else? I don't know, but I'm not going to take the chance to infect someone else, because I think psychologically, I don't want to be the person. Oh, wow, I gave that person COVID. I didn't know I had symptoms, or I didn't know I had it. So I guess when in doubt is the theme. When in doubt, just put it on. And Dana?
Yeah, I was just going to ask, since Zoe, you said you didn't have the equipment before and you had to recycle. So are you limited now to what you have? Like, say, like for in that area, you're only allowed to have this box and that's it. Or you guys have an ample amount now and everything's okay?
Yeah, we have an ample amount now, and so I feel more confident at work to know that I'm protected, and to know that if my mask is soiled, or as I'm taking it out, if it falls to the floor, that I could get a new mask.
That's so crazy, because those pictures and videos of people in like bags and recycling, and the lines of constant just using the same mask. So yeah, now that you're saying that, we know it's real.
Oh yeah, and the nurses have to wear these for 12 hours. So the pressure on that, because it's really tight, that N95 mask. And I've seen her with those lines on her face, because she does have to wear that 12 hours. And it causes pressure on the bridge of their nose and a lot of other skin problems from having to wear that. Imagine for 12 hours,
Yeah, I actually have a permanent indentation on my nose. So I was telling all the nurses we're gonna need major surgery to get the bridge of our nose restored, because
and rhinoplasty.
Rhinoplasty. If people are aware that the N95, there is a metal in the middle that presses on to the bridge of your nose to put the seal on your mask. That way no air is coming in and out. So you're breathing your own air in and out. So like 5, 6 hours into the shift, you start to either have migraine and dehydration from lack of water, fatigue on top of that, and just decrease oxygen intake and inhaling your own CO2. And I was telling Roslyn, because she doesn't have to wear the N95, you could actually smell each and every part, like gastric juice circulating into your stomach. It's like having an open window into your intestine, and breathing that for 12 hours. It's just nauseating. It's like sometimes I feel like, man, did someone die inside of me? It's just so real every day for 12 hours. So your 12-hour shift is actually, especially working graveyard, a 24-hour shift, because you need time to recharge and recuperate from that shift and sleep and breathe normal air and sleep normal and drink water that you didn't drink for 12 hours. So it's a tough job.
Like I said at the beginning of the show, yeah. Like I said at the beginning of the show, you guys are the true heroes because I don't know. I'd start looking for another job if it was me. I mean, for me personally, I think. I say that I'm also in the military, so there's things that you put yourself through to help others, and I thank you for your service. I really do appreciate each and every one of you for your service, and I thank you for coming onto the show and trying to help us dispel some of these questions or doubts about COVID. I know the Dr. Goddard wanted to talk about the school and what's going on at the school. We can wrap it up with you.
So there's 3 issues I would like to address. It's really important. This is like hidden side effect of the COVID. We shift from the medical to the mental issue. A lot of high school kids, I see them in my office. Mostly they had an identity connected to the sport activity. And now they don't have sport activity, and all what they have is Zoom meetings that really impact them emotionally and cognitively, and does impact also the school performance. Part of identity we're taking away from them. There's no sport, there's no training, there's nothing. That's really important. We have to monitor our kids and make sure when we can seek help when it's needed and not just ignore it. We cannot just say, oh, wait, it's going to be okay. It's not okay for some of the kids. That's one thing. The other factor is it's really important, the family dynamic, how to cope. Self-care is very important, especially for the parents. Make sure you implement any coping skill you think is helping you to cope with it. Don't overdo it. Just do it to the point where you can accept it. Some of the parents, they have to work at home. They have to be with their kids on Zoom. They have to deal with their partner 24/7. It's really impacting the family dynamic, impacting the children. And that will lead sometimes to suicidality. It's very important, self-care, whether for the children, for the couple, for the single parents. For us as professionally, we have a group, we talk to each other sometimes as therapists, how we can deal with it. It's seek help. It's not too late.
Yeah.
There is nothing wrong with that.
I think that's a whole nother show, right? We can probably sit there and say, hey, the effects of COVID and the lockdown. You're so correct. You are so correct. Self-care is very important because even in I can probably not testify for everybody, but I know I can testify for me and Dana that being locked in your house 24/7, and she's probably wanted to like kill me in my sleep, but she doesn't because she's nice. But I know there's that's a whole nother show. We might talk to you again later because I think that's important. Your mental health is just as important as your whole physical health.
The financial aspect with it too, but
exactly.
The mental health is really important. We have to pay attention to our children.
Wow, that's awesome. You're on mute, babe.
Okay, thank you.
Well, thank you. I really appreciate you guys coming on. Any final words that you want to kind of leave behind? We'll start with Zoe and go from left to right in my screen.
I just wanted to, well, thank you for giving me the opportunity to speak and share my knowledge here. And I just wanted to give this opportunity to let everybody know to just come make this a time to come together and support each other. And I'd like to thank the doctor for bringing that into limelight that mental health is the best health because where the mind goes, the body follows. And you could either, I believe in seeing the good in everything. So you could either swallow in misery or you could swim in victory. So this is the time to reinvent yourself, to know who you are. You know, there's strength in being alone, and you don't have to be alone. Reach out to someone. Reach out to someone, and take care of your mind, take care of your body, and wear your mask.
Thank you.
This is real. This shit is real.
Yes, doctor.
Me? Oh, I just want to make sure that the parents pay attention to their children's cue sometimes, especially the one they were involved in a lot of sport activities, other hobbies they had. Now they lost as part of their identity. Self-care, whether a couple or singles, just there's a lot of coping skills there. You can do it. Don't ignore it.
If you see your child, acting a little weird, what would you suggest, doctor? How would we approach them? How would we approach their sadness?
Yeah.
What would you suggest?
Sometimes you can just go online and seek help. There's a lot of free services there. I provide sometimes free services for parents that cannot afford it. Seek help if you know you cannot do it, if you are self-overwhelmed. Let somebody else help your child, but do not ignore it. Do not put it to the side. Because I see suicidality in a lot of teenagers. The social media is very part of their life. Interaction, sport activities, and now school, they have to sit on 6-7 hours Zoom with no social interaction. There are a lot of them that are not doing well. The social interaction is important, and they don't have it now. So we really have to pay attention. And especially couple, I see a lot of couples here. Just too much.
Wow.
It become very overwhelming.
Yeah.
Self-care. There's a lot of coping skill out there. This is a different show, you said. It's going to take me an hour to talk about it.
Like that. Yes, exactly.
Yeah, it's important. Self-care.
What we'll do is we run live, but we also will publish a show and have a recording posted. If you would like to share your information, your contact information, please let us know. We'll post that up there.
Yeah, it's another show. Coping skill, taking care of the mental issue is completely at least 1 hour show. And yeah. I thank the medical professional there for all the information. It was very helpful. Appreciate your time also.
Thank you.
Ladies there. And share Dana, and we know each other.
How about you there, Lynn? You got any parting words?
Yes, first I want to thank you for inviting, Dana, Eric, and James for inviting us to this live podcast. It's really an honor to be able to speak here and speak openly and speak about the truth. Thank you for that. So I think my exiting advice is really to continue to protect yourself and others by wearing your mask, practicing social distancing, and washing your hands often, or hand sanitizing. Let's continue to do that together because, like Zoe said, we are in this together. Knowledge is power, so be educated, speak with the experts, and read facts. So that's basically my advice for everyone. Thank you.
Ladies, so much. Thank you so much for being on today.
I appreciate everything. I need to get ready for my clients.
Thank you.
Thank you so much. Thank you so much.
Now I can edit
so much.
I think you just pressed sleep.
There you go.
Uh,